Hey, this is Dr. Davis, and I'm going to show you how to work on your ankle mobility for a deep squat using a band and using a knee mobilization here. So really I should say it's an ankle mobilization, but you'll move your knee outward to mobilize the ankle so that you can get into a deep squat and get your knees wider than your toes. Now the basic rationale here is that as your knees move inward, your arches collapse, which makes for a less stable foot and a less stable hip and knee joint. If your knee presses out wider than your foot, your arch naturally lifts, your knee is more stable, it's in a safer, stronger position, and your hip generates stability and strength. So I'm going to take a thick band or a belt and loop it around something nice and sturdy like so. There we go, nice and strong. Then I'll step inside of the band here and get this up by my hips, sit down, so I'm sitting back, putting a little bit of stretch on this band, and then sitting down nice and low. So this could actually be a little bit lower. I'm going to lower this so that's approximately where my hips are in a deep squat. The band is assisting me so I can kind of lean back and maintain an upright posture. Without the band, I would have to be leaning really far forward and I wouldn't be able to get all the way into my deep squat. Now, once I'm down here in this deep squat and I can have an upright position, I want to pay attention to the direction of my feet and where my knees are. Now, my feet, if I can, I want my feet to point basically forward. If they point a little bit out, it's not a big deal, but what we're trying to avoid here is that, so look at my knee and look at my toe. I don't want my knee collapsing inward of my toe. That's just not a very strong position. So you're just gonna be stronger if we can start to work on this knee pressing out, and you're going to have better ankle mobility. So the thing is that a lot of people, when they get into a deep squat, they cheat, right? Because they don't have the ankle dorsiflexion. They can't actually bend this ankle. Here, I'll show you from another angle. So they can't actually bend this ankle forward and get this angle right here. And so in order to basically cheat and get that, well, if I can't go forward, straight forward, if I turn my foot out, I can fake it and I can get my knee further forward, but I'm not actually increasing this angle right here. So if I get my foot forward and try to push my knee forward, I might not be able to go as far. So that's where we really try to hold the foot down and move the knee out. Now, when we're using a band here to have an upright posture, you have your hands free. So you could take one hand to the inside of the foot and pin it down as you take the other hand to the inside of the knee and press this out a little bit, right? And you can spend some time in this deep squat just hanging out here and gently pushing out. And you could do the other side and gently push out. The key here is that if you try to push the knees out, most likely what's gonna happen is your feet are gonna turn out, right? And if your feet don't turn out, the inside, they're gonna kind of like open up, right? You'll try to push and then that'll happen, where the foot just lifts up, right? It just lifts up off the floor. So what I want you to do is try to push, just sit in a normal position, try to get those feet forward, and then pin the foot down, and then use your elbow to gently nudge the knee out, right? And then you can even kind of, get both sides and use your elbows to push your knees out, okay? As long as your feet don't fold open or supinate too much, right? I want your arch to lift, but I want your big toe and your big toe mound right here to maintain total firm contact with the ground. So we're holding this down and we're doing this and pressing the knee out. So it should feel like you're rotating. You're rotating here at the ankle joint, right? So it's kind of weird and it's gonna take some getting used to, but this band is here to help you maintain an upright posture as you do this. And then as you get used to this position more and more, you can just kind of get in here. Now watch this, look at I've got pretty good mobility, but if I do this and I push my knees out, my toes do turn out. Look at this. So I'm not saying you can't have your toes turn out a little bit. It's okay to have your toes turn out a little bit. But if your toes are wider than your knees, like this, that would be silly. But if your toes do turn out, as long as you can get your knees out even further than your toes, then you're in good shape. Don't worry about it. So don't get obsessed about your feet pointing exactly straight forward. If they turn out a little bit, that's okay. We just want to get the knees even further out and spend some time in this position. And try to grab onto the band or the bar and pull yourself forward here too, so you feel maybe a bit of a stretch in the back of the calf as well, the soleus and some of those deeper muscles. And spend some time rocking over to one side. So guide the knee, rock forward, and try to guide the knee out. Go on the other side. Guide the knee forward, feel a little bit of a stretch, and guide the knee out. And just try to keep that big toe pinned down the whole time. If you need to use the hands to assist it and get into this a little bit, then do that. Okay? So spend time here, at least 2 minutes consecutively, minimum. Otherwise, you're not going to get actual tissue remodeling. If you spend at least 2 minutes consecutively, then the fibroblasts, the connective tissue in your ankles, actually will start to make a plastic change. They will start to remodel and your ankle will change. If you spend less time than that, then the muscles will change a little bit temporarily, and it's more of a neurological change, a pain sensitivity change, a muscle relaxation or inhibition change. But if you spend more time than 2 minutes consecutively, then your actual tissues will remodel if you do this on a daily basis or a regular enough basis. So spend time. If you have questions, leave them in the comments. And I'll see you in the next video.